Bridges. Buckner. Coleman. Cook. Coram. Danielson.
Morning.
Finberg. Fields. Fields. Continue on. Gardner. Janal. Gonzalez. Hanson. Heisey. Holbert. Hopkins Lewis. Kirkmeyer. Colker. Lee. Liston. Lundeen. Moreno. Pedersen. Pedersen. Priola. Rankin. Rodriguez. Scott.
Here.
Simpson. Smallwood. Sonnenberg. Sonnenberg.
Should I tell Morgan?
We're short 3.
Do I tell you and then you can tell Morgan?
Sonnenberg excused.
But I'll let her know.
Story. Story. Winter. Woodward. Zenzinger. Pedersen.
Approval of the journal. Senator Buckner.
Thank you, Madam President. I move that the reading of the journal of Wednesday, March 10th, 2021 be dispensed with and that the journal be approved as corrected by the Secretary.
You have heard the motion. All those in favor say aye. All those opposed say no. The aye has it, and that motion is adopted. Senate Services.
March 11, correctly printed Senate Bills 178, 179, 180, 181, correctly re-engrossed Senate Bills 67, 75, 78, correctly revised HJR 1002.
Committee reports.
March 9th, Committee on Health and Human Services, out of consideration of the merits, the committee recommends the following. Senate Bill 97 be referred to the Committee of the Whole with favorable recommendation and with recommendation to be placed on the consent calendar. March 9th, Committee on Health and Human Services, after consideration of the merits, the committee recommends the following. Senate Bill 102 be referred to the Committee of the Whole with favorable recommendation and with recommendation to be placed on the consent calendar. March 10th, Committee on Business, Labor, and Technology, after consideration of the merits, the committee recommends the following. Senate Bill 120 be postponed indefinitely. March 10th, Committee on Business, Labor, and Technology, after consideration of the merits, the committee recommends the following. Senate Bill 141 be referred to the Committee of the Whole with favorable recommendation. March 10th, Mr. President, the Committee on Business, Labor, and Technology has had in consideration, has a hearing on the following appointments, recommends appointments be placed on the consent calendar and confirm. Member of the State Plumbing Board for a term expiring July 1st, 2024, John William Hill of Colorado Springs, Colorado, a plumbing contractor engaged in the construction of residential commercial buildings, appointed. March 10th, Committee on Health and Human Services, after consideration of the merits, the committee recommends the following. Senate Bill 122 be referred to the Committee of the Whole with favorable recommendation, and recommendation to be placed on the consent calendar. March 10th, Committee on Health and Human Services, after consideration of the merits, the committee recommends the following. Senate Bill 11 be amended as follows, and so amended be referred to the Committee of Appropriations with favorable recommendation. March 10th, Committee on Health and Human Services, after consideration of the merits, the committee recommends the following. Senate Bill 101 be amended as follows, so amended be referred to the Committee on Appropriations with favorable recommendation. March 10th, Committee on Health and Human Services, after consideration of the merits, the committee recommends the following. Senate Bill 93 be referred to the Committee of the Whole with favorable recommendation and recommendation to be placed on the consent calendar. March 10th, Committee on Health and Human Services, After consideration of the merits, the committee recommends the following: Senate Bill 92 be amended as follows, and so amended be referred to the committee of the whole with a favorable recommendation and with the recommendation to be placed on the consent calendar.
General orders, second reading of bills, consent calendar. Senator Zenzinger.
Thank you, Madam President. I move that the Senate resolve itself into the Committee of the Whole for consideration of general orders, second reading of bills, consent calendar.
You have heard the motion. All those in favor say aye. All those opposed say no. The motion is adopted and the Senate will resolve itself into the Committee of the Whole for the consideration of general orders, second reading of bills, consent calendar, and Senator Zenzinger will take the chair.
Wait until we're back.
The committee will come to order. The coat rule is relaxed. Will the clerk please read the title of all the bills on general orders, second reading of bills, consent calendar?
Senate Bill 145 by Senator Simpson, Representative Valdez D, concerning the extension of the period of time that voluntary contributions that are set to expire in 2021 will appear on the state individual tax return form. Senate Bill 96 by Senators Coker and Piola and Representative Byrd, concerning the continuation of the Workers' Compensation Classification Appeals Board and in connection therewith implementing recommendations contained in the 2020 Sunset Report by the Department of Regulatory Agencies.
Majority Leader Fenberg.
Thank you, Madam Chair. I move for the adoption of all the bills on the consent calendar and their associated committee reports, which include Senate Bill 145, Senate Bill 96, along with its Business, Labor, and Technology Committee report.
Is there any discussion on the committee report? The motion before the body is the adoption of the committee report on general orders, second reading of bills, consent calendar. All of those in favor say aye. Those opposed, no. The ayes have it, and the committee report is adopted. Is there any discussion on any of the bills on consent calendar? Seeing none, the motion before the body is the adoption of the bills on general orders, second reading of bills, consent calendar. All of those in favor say aye. Those opposed, no. The ayes have it, and the bills are adopted. Majority Leader Fenberg.
Thank you, Madam Chair. I move the committee rise and report.
The motion before the body is to rise and report. All those in favor say aye. Those opposed, no. The ayes have it, and the committee will rise and report.
The Senate will come to order. Senator Zenzinger.
Thank you, Madam President. The committee has met and had a number of bills under consideration. Will the clerk please read the report?
Madam President, your committee of the whole begs leave to report has had under consideration the following attached bills being the second reading thereof and makes the following recommendations thereon. Senate Bill 145, Senate Bill 96 as amended, passed on second reading in order engrossed and placed on the calendar for third reading and final passage.
Senator Zenzinger.
Thank you, Madam President. I move the report.
The motion is the adoption of the Committee of the Whole report. Are there any no votes? With a vote of 34 ayes, 0 noes, 0 absent, and 1 excused, the Committee of the Whole report is adopted. General orders, second reading of bills. Senate Bill 145, Senate Bill 2196 is amended, passed on second reading, and ordered engrossed and placed on the calendar for third reading and final passage. General orders, second reading of bills. Senator Zenzinger.
Thank you, Madam President. I move that the Senate resolve itself into the Committee of the Whole for consideration of general orders, second reading of bills.
You have heard the motion. All those in favor say aye. All those opposed say no. The motion is adopted and the Senate will resolve itself into the Committee of the Whole for consideration of general orders, second reading of bills, and Senator Zenzinger will take the chair. Who's in charge?
Marcia still doesn't like it. Keep the code rule on for that one.
Come on up.
Move it.
I don't fight. I'm gonna. Is that all right?
The committee will come to order, and the coat rule is relaxed. Will the clerk please read the title to Senate Bill 123?
Senate Bill 123 by Senators Janal and Quorum and Representatives McCormick concerning expanding the Canadian prescription drug importation program to include prescriptions drug suppliers from nations other than Canada upon the enactment of legislation by United States Congress authorizing such practice.
Senator Janal.
Thank you, Madam Chair. I move Senate Bill 123. There are no committee reports.
To the bill.
Thank you, Madam Chair. This bill authorizes the Department of Healthcare Policy and Financing to expand the program to allow drug importation from nations other than Canada upon enactment of federal legislation permitting states to do so. In 2019, we successfully passed Senate Bill 5, which allowed HCPF to pursue a Canadian prescription drug importation program. This helps Coloradans struggling with the escalating costs of their medications. The United States pays the highest cost in prescription medications. I don't think this issue actually affects one side of this aisle or the other. It affects everyone. It affects seniors who, are progressively as they age, need medications for heart disease.
Excuse me, members, it's a little loud, and the sponsors are having difficulty. If you could please keep your talking to a minimum. Go ahead and proceed.
Thank you, Madam Chair. As I was saying, this is not an issue that affects one side of the aisle or the other. It affects all of us. It's bipartisan. Seniors, younger people, and families with high deductible plans. Some of them have to do out-of-pocket costs for prescription drugs. But underserved populations as well as people of color who are disproportionately affected by chronic conditions. It's a fact that there is an increase, significant increase, in diabetes and heart disease and stroke in people of color. In the United States, the brand name prescription drug prices are averaging about 3.5 to 4 times the prices that are paid in other countries. Countries like Australia, the United Kingdom, France, Germany. Why? They have put in price negotiation capabilities and other controls that we as a nation have not. HCPF analyzed 50 top prescribed drugs used in Colorado and compared these prices for the same brand drugs, exact same thing, from Canada, France, and Australia. Importing from Canada saved by commercial carriers, you can save about 63% on the cost of a prescription drug. If you import from France, 84%. If you import from Australia, 78%. So Senate Bill 123 expands the Canadian importation program to additional countries should federal statute be changed to permit it. And I just want to touch upon another thing that comes up, and that's drug safety. This bill maintains the strict standards and regulations that are in place now. We're not importing narcotics. We're not importing biologics. It is FDA regulations that we trust as consumers every single day. Specifically, I want to give you an example that is important to us right now. The current example is Pfizer vaccines. And I want to thank Pfizer, Moderna, and Johnson & Johnson. They, particularly Pfizer in this case, 1 billion units are being distributed from the United States and German manufacturers and manufacturing sites to sell the exact same vaccine all over the world. According to Pfizer's own website, we have years of proven experience in supply chain and cold chain management, and we are accelerating development of innovative technologies to further advance our capabilities as a supply chain leader. Our track record gives us confidence in our ability to quickly scale and manufacture and distribute large quantities of a high-quality COVID-19 vaccine, leveraging multiple sites in the United States and in Europe. So to clarify, this bill would enable importation of the same drugs that we are getting now from other countries, but will enable us to bring them into our state of Colorado, at a lower price through our importation program. It also ensures compliance with extensive drug safety, regulatory framework, and other factors. Specifically, they have to be FDA approved. The FDA has cooperative agreements and plant inspections with other countries. For example, the FDA has cooperative agreements with the European Medicines Agency, the EMA, which covers the 27 nations in the European Union. Also, Health Canada, the Japan Ministry of Health, and Therapeutic Goods Administration, which oversees and is the FDA of Australia. These drugs that we are importing have to be sample tested for quality, for authenticity, and for degradation, tracked and traced according to federal supply chain law, and relabeled in the United States using our FDA labeling requirements. I ask for your support on this bill to expand the Canadian drug importation program that is underway right now because of Senate Bill 5. And please support this bill to expand it to other countries other than Canada. Thank you.
Senator Corum.
Thank you, Madam Chair. I was asked, why would I be on this bill? Why? Good question. Thank you. In Southwest Colorado, Senate District 6, 14% of prescriptions go unfilled because they can't afford them. 14%. So when they fail to take their medication, the problem sometimes gets worse, most often does, and they end up in emergency rooms. That is more costly to us. So I think it's important that we realize that this actually will save us a lot of money. In the long run, it is bringing in drugs, brand name drugs, already manufactured, that's probably on your local pharmacy shelf right now. But just an example of what this negotiations can do. Dolera, a prescription asthma medication. In the U.S., we pay 4,833% more than the average cost of the drug in the UK, Japan, Canada, Australia, Portugal, France, Netherlands, Germany, Denmark, Sweden, and Switzerland for the exact same drug. I think we owe this to our seniors, those that are just prior to retirement, that 55 and up group, that they're actually starting to see an increase in medical costs. And this is a huge factor for them. I remember a few years ago when we talked about foreign drugs and everybody wanted to show a picture of a little back room in a third world nation. That's not what this bill is. This is from manufacturers that's already producing the drugs that are on our shelf. This is a very simple concept. It allows us to negotiate the price. How many of you have bought a car in the last 5 years? Did you look at the sticker price and say, yep, that's what I want to pay, and write the check? No, you negotiated. And that's all we're asking to do here, negotiate. Ask for an aye.
Senator Smallwood.
Thank you, Madam Chair. Good morning, colleagues. Those who are left here. So I was no vote in committee on this, again, as this topic keeps coming up. So I do want to thank the bill sponsors, though, because healthcare is expensive, continues to be expensive. And I always commend folks who are at least working towards helping solve that problem, even if I don't necessarily agree with their methodologies. I'm not one that thinks that that we should just get rid of the FDA. If other countries have got prescription drugs figured out, then why do we even bother with the FDA? Why is it that large employers or governments aren't encouraging their colleagues, employees, teammates? Why is there no big push encouraging people to take vacations to Mexico and load up on medications there? Why have you not seen that? Why has the state of Colorado not put out a memo to all of us over the last decade that said, you know what? If you happen to be traveling to Southeast Asia or to Mexico, if you can walk into a pharmacy, which I think you probably all know you can, please pick up some, extra medication while you're down there. Because it's just as good as what you're going to get here in the United States. We have complete confidence in that. We don't need the FDA actually going and doing some research to figure out whether or not these drugs are safe. Just load up. It's way cheaper there. So we have to ask ourselves, why is that not happening? Why aren't municipalities and state governments telling their employees to consider doing that? Why aren't large employers telling their employees that it'd really be an intelligent thing to do for them to load up on prescription medications while they're traveling in foreign countries? I think I know. Because they're worried that they might not be safe. I'm worried that they might not be safe. I won't take those. Now, I get why my colleagues might think that the FDA is maybe misguided, in maybe that there's no need for it at all. But when we have government agencies come out, presidential administration after presidential administration after presidential administration, and tell us, we don't think this program is going to work. Yet here in Colorado, we continue to push this as if this is going to solve the healthcare affordability problem. Are we really that much smarter than the FDA commissioner and the head of HHS in the Obama administration, in the Trump administration, who have all said this isn't going to work and it probably isn't safe? We heard just a few minutes ago, people can't afford their drugs. And I understand that some people can't afford their drugs. But colleagues, I have you think through the individuals that we're talking about here who need help paying for their drugs. We expanded Medicaid in this state several years ago. We have nearly a quarter of Coloradans covered under Medicaid. These are the people who have the most financial need in our state. How much do they pay, colleagues, for prescription drugs? $4. Who knows how much they pay? $4. $4. $4 for prescription drugs is what almost 1/4 of our state pays. Now, I understand $4 isn't $0. $4 is a lot to people. But when you say we need to potentially sacrifice savings so that $4 might turn into what? $3? It's not going to go to zero. And my assertion is that the $4 is still going to stay $4. So you've got the vast majority of the neediest Coloradans who aren't going to benefit at all from importing drugs from other countries. At all. We heard in testimony that even the Medicaid system in Colorado, guess how much the system's going to save if we do this? We heard it in committee. $0. That's how much the Medicaid system is going to save. So Medicaid patients are going to save $0. the Medicaid system is going to save zero. And that is for the neediest Coloradans and the taxpayers of our state. So let's move up a notch. The next batch of neediest people. There was a law that passed a few years ago. You might have heard it. It's called the Affordable Care Act, which was going to make health care affordable for all Americans. The Affordable Care Act put a cap on total out-of-pocket costs for every American who buys their health insurance. So not for people on Medicaid, not for people on Medicare, but if you buy your health insurance, the Affordable Care Act is going to put an affordable cap on the total cost of health care, including prescription drugs. Everything gets put into the same bucket. Doctor's visits, hospital visits, ER visits, every nickel you spend accumulates towards the out-of-pocket maximum, which was established under the Obama administration as what they felt was going to bring affordable health care. So colleagues, when you hear that your friends and neighbors are having to pay $20,000 for prescription drugs or $50,000 for prescription drugs because these drugs are so expensive, I think we need to ask the question, where are these people getting their health care? Are they simply uninsured? That's not what we heard in committee. Are they on Medicaid? Very often. Are they on Medicare? Perhaps. But if they buy health insurance in our state, all their cost of prescription drugs go towards this out-of-pocket maximum, which has been deemed by the federal government under the Obama administration to be affordable. So who are we really trying to help here? And is it worth sacrificing safety? I know the government will tell us this is all safe. Here's what the government told me. I know what the FAA told me. It's safe to fly on a 737 MAX. Fly away. Guess what? They were wrong, colleagues. It wasn't safe at all. But that's the FAA. I suppose this is different. We're told that the Affordable Care Act was going to bring affordable health care to everybody. Guess what, colleagues? From what I'm hearing today, it hasn't. That's why some of my colleagues here on my right said, well, we got to create our own exchange in our state. And then we heard, no, we were just kidding. That actually isn't saving any money either. We still need to fix this. So then a few years ago, we said, you know what, listen to us. We're the government. We're going to create a reinsurance program, and that'll drive down the cost of health care, and everything will be affordable if we just did this. But then we heard 2 years later, no, we were just kidding. The reinsurance didn't do nearly enough. Let's create a health insurance affordability enterprise. And if you just do that, forget about the Affordable Care Act and Connect for Health and reinsurance. If you'll just listen to us and allow us to create this health insurance affordability enterprise, then we'll have fixed the problem. Whether we're talking about hospitalization, doctor's visits, prescription drugs.
Senator Smallwood, we've kind of strayed from the bill a little bit. If we could please confine our comments to 1, 2, 3. Thank you. Speak to the bill.
This bill? The one that's going to make health care more affordable? Very much like the Affordable Care Act and Connect for Health and the reinsurance fund. Yes, Madam Chair, I appreciate it.
Except the bill and not the other thing, correct.
So colleagues, if you pass this, we can forget all about the other pieces, I think, because this will help with affordability. So if you see any other bills this session talking about needing to drive down the cost of prescription drugs with some new government enterprise, I suppose we can say, you know what, we won't need that, because what we've been told is that if we just bring in some good foreign drugs, this will fix our problem. Colleagues, I don't think this is the right solution. We've been told, and this is no dig on the bill sponsors, we heard in committee from government departments I don't think this is any of my colleagues creating this and trying to drive this forward. We're told by the government again that this is going to fix the problem. You're the ones, I'm the one, that are going to need to face our constituents if these drugs end up not being safe. And I agree with the FDA commissioners. I agree with the leaders of Health and Human Services federally, who have said year after year after year that this won't work and they can't guarantee safety. Colleagues, that's why it hasn't happened yet. How many years have we been hearing about this? I can count 6 so far that this is going to happen. Why hasn't it happened? Let's think it through. I'd ask for a no vote on this bill and appreciate the latitude, Madam Chair.
Thank you. Senator Quorum.
Thank you very much, Madam Chair. It pains me so much to remind my young colleague, President Trump campaigned on this very issue. President Trump, that was one of his big things at each and every rally that he did, affordable drugs. I also hate to burst the bubble that the drugs that you're using off the prescription counter right now are more than likely coming from the European Union or one of those countries. We're not getting rid of the FDA. We're actually putting an extra level of testing in to verify more than we do a drug that's manufactured in the United States. This goes through further testing. It is tested. It is safe. And in the Vermont of people will be traveling to other countries to get drugs. In my midlife crisis, I lived in Phoenix, Arizona, my winter home. It was a regular bus tour for seniors. Now, I don't know if any of you ever been to Phoenix, but there's a couple of seniors live in Phoenix, Arizona and the surrounding area. And they take tour buses to Mexico to buy prescription drugs. Mexico is not on this list, but seniors in Phoenix, Arizona travel to Mexico. My brother-in-law is from Minnesota. You know what? Same thing happens in Minnesota. They cross the border to buy cheaper brand name prescription drugs. And you know, this has to be approved by the federal government. Colorado cannot do it on its own. But there's several states, Florida as an example, that are doing this. There's other states working on it. Because the high cost of prescription drugs is a major factor. Before I got here, I didn't need blood pressure medication. Now I do. And I was standing in a line a couple of weeks ago, and a gentleman wanted to get his prescription. And they said, your copay is $550. What? Your copay is $550. That equals my monthly Social Security check. Now, he had some resources or something, I don't know. He said, I'll be back. I'll get some cash. I'll be back. I don't know if he did or didn't. But he left there with that prescription unfilled. Because with that, we have young people that are not on Medicare, they're not on Medicaid, but the cost of living of raising 4 children is extremely high. And many a time they make the choice, and I've seen it, do I buy the prescription drugs my family needs and let them eat top ramen soup for a week? Or do I buy a healthy protein diet? It's a choice they shouldn't have to make. And you know what? If you don't want to buy those drugs, there's nothing here forcing you to do it. It's just, it gives those the opportunity to participate in this program, the ability to save money. Ask for an aye vote.
Senator Janal.
Thank you, Madam Chair. I just want to clear up a couple of questions that were asked by my colleague from Douglas County. It was referred to that Medicaid folks are only going to pay, they pay $4 for a prescription. And so this really is not about helping Medicaid so much as it is helping people who have health insurance plans, or maybe don't have any insurance at all and have to pay out of pocket. So with the health insurance plans, I think it might possibly decrease the premiums because that is a large chunk of what our premiums in healthcare are, about 20%. We heard from the Department of Corrections, and just looking at the data with the 50 drugs that were analyzed for this report that HCPF put out, comparing the prices to Canada, to Australia, and to France, the Department of Corrections said that they would possibly save, if not more, but at least $8 million in medication prices. That's a lot of money to save the state. The other thing I wanted to address is this bill, it's not a mandate. A lot of other bills that come along with, that are for prescription drugs, they're mandates on the pharmaceutical companies. This is an innovative way to get around not mandating pharmaceutical companies, but to buy drugs and import them from other countries where we know they're safe and FDA approved. So I just think that if we could save 75%, use an innovative way that doesn't put a mandate on pharmaceutical companies, I think it's a great way to lower the price of prescription drugs for the people that need them and can't afford them, are cutting them in half, skipping doses. They shouldn't have to do that. And another thing my colleague did say, and I wanted to, just wanted to mention, is that, you know, we've gone through a number of administrations where the Canadian importation was granted in 2003. But it's never been utilized until the last administration. In November of 2020, Alec Azar, then the Secretary of Health and Human Services, approved this to move on. So this federal okay is allowing us to move on with Canadian drugs, but also it's Colorado and Florida that are leading the way. There are about 15 to 20 other states that are looking at legislation comparable to this to help save their constituents money. But Florida and Colorado are the ones who are leading the way, and Florida expanded this. We would have last year had it not been for COVID. We are doing this year so that we can include the other countries and get the lower prescription costs. So thank the other administration, the last administration, for moving this forward when all the other administrations since 2003 haven't. And I ask for your support on this bill. It is saving people money.
Senator Fields.
Thank you, Madam Chair, and I want to thank the good senator from Montrose and the good senator from Fort Collins for bringing to us Senate Bill 123. This is not the first time that we've seen this type of bill, because in 2019, we passed legislation that included the opportunity for us to expand the Canadian Prescription Drug Importation Program. We already passed it in 2019. And so what this bill does, it includes the importations from other countries. The United States of America has a global standard when it comes to the regulation as it relates to drug programs from other countries. I heard this bill in committee, and we had testimony that suggested that 80% of the pharmaceuticals that we take come from outside of the United States. 80%. So this is something that's already happening right now in the USA. So for us to claim that by expanding this program that there's going to be less safety is just not true. It's just not based on facts. It's just not based on our standard. And this can be verified through data and through science. Look it up. We're already consuming pharmaceuticals from other countries. And we heard testimony that it's labeled. So I'm not sure if you're taking any medication today, but check to see where it came from. You might find out that it was not produced in the USA. Ensuring that the people in Colorado, our patients, have access to affordable medication is a good thing to do. But I agree with the argument we need to make sure that it's safe. And based on everything that I've learned, everything that I've read, it is safe, because it's a practice that we're doing right now. So basically what this bill does, based on what we did in 2019, it expands the market beyond Canada. To ensure a cost-effective medication supply in the state of Colorado. This is doing what many of our constituents want. They don't want to have to make a choice between purchasing their medication or buying food, or purchasing their medication and deciding if they can pay their rent or their utilities bills. Some people, when they go shopping, this is to the bill, Madam Chair, when people go shopping, some people take, clip coupons, or they look for the most cost-effective price on whatever that's being sold. We all want to save money. So if there's an opportunity for us to have affordable prescriptions that is safe and that's reliable, that's scientific, that's proven to do the same as a generic drug or whatever, why not? We already do it. So who are we as elected officials to say, not so? This bill if you look at it, there's no appropriations. It just says that if it's authorized, then we can have the opportunity in the state of Colorado to expand the Canadian drug importation program that we passed in 2019 under the rules that are proposed by the FFDA for authorization. We have a global standard. I don't think there's much risk in this because you have a choice, just like with generic drugs. You can say you don't want to take it, or you do. We talk about local control and choice all the time down here. Why wouldn't we want to make sure that the people of Colorado have a choice as it relates to the prescription drugs that they want to consume that would help them save money as long as it's safe and secure? This bill is the same as 2019. The only thing that we're trying to do is to expand it. As chair of HHS, there was only one person that opposed this bill as it relates to testifying against the bill. I think we might have had maybe 10 to 12 people that testified, AARP. There was just a lot of folks that showed up just saying that I'm paying too much for my prescription drugs. This is an opportunity for me to lessen that burden because it's hard for me to make ends meet. If I can save $10, $20, or what have you, I want to save it. This is popular amongst people who rely on an ongoing issue that they have with chronic diseases where they have to take medication. And this is an opportunity for them maybe to save $20. Maybe it's $30. Whatever. I don't manage their budget. But if they're saying that they want to be able to have the option to have a different cost structure regarding a prescription drug that's proven to be safe, why would we want to get in the way of that? Members, please vote yes on Senate Bill 123.
Senator Smallwood.
Thank you, Madam Chair, and thanks to my colleagues from Aurora, Fort Collins, Montrose. It's an honor to serve with all of you. We just disagree on this, is what this is. And I will tell you, this newfound trust in government that I'm hearing from my colleagues is incomprehensible to me. The newfound trust in insurance companies and PBMs, pharmacy benefit management organizations, the newfound trust you have in the Department of Corrections and the Medicaid system is 180 degrees from what I've heard for the last 4 years. We as elected officials should give people the choice to save money if they want to. We heard that taking these drugs is going to be a choice. Show me in this bill, colleagues, show me in this bill where the patient at the end of the day is going to have a choice, that the patient is going to be notified by their insurance company that that PBM imported drugs from another country. You're not going to find it in the bill. You know why? Because it's not part of the program. You're never going to know as a patient. We heard from the Department of Corrections that this program is going to save them a lot of money. Show me in this bill where an inmate in the state of Colorado, when they go to get prescription drugs, is going to be given the choice of two. Here's one that's been imported, here's where it's been imported from, and here's one that hasn't been imported. My assertion is that that is not part of the bill, and that is not going to happen. And citizens of Colorado, when you hear from government that trust us, you're going to have a choice. I vaguely remember somebody saying that you'd be able to keep your doctor if you just gave it up under a different kind of government health insurance program that we created. Guess what? That didn't happen. We heard drugs are not going to be imported from Mexico. Show me in this bill where it says drugs are not going to be imported from Mexico. You're not going to find it in this bill. You know why? Because it's not in this bill. What this bill says is that whatever the federal government says at a later date and time goes. That's going to be the rules. That's going to be the law. And guess what? If the federal government says they're coming from Mexico, then they're coming from Mexico. And that's not my concern. My concern is not where these drugs are coming from. And I'm not alleging that drugs from Canada are somehow better than drugs from Mexico or Vietnam or Germany or France or the UK. Colleagues, that's not my point. My point is that when you hear that we're ceding this authority and responsibility, even at the lowest level, to somewhere else, what I'm saying is you are potentially exposing our citizens to risk that they don't have today. So, you heard you're going to get a choice. I don't see that in the bill. And quite honestly, I don't even know that that makes sense. And we certainly didn't hear from Department of Corrections that our inmates are going to get a choice of which drugs they take. I don't believe that. Secondly, you heard we're not going to import drugs from Mexico. Show me in the bill. Where are the countries that we're going to import from? It's not in the bill because the federal government decides. And we were told you don't have to take these drugs even if you're not in the Department of Corrections or Medicaid. If you think that the pharmacy benefit management companies in your private insurance plan are going to tell you where the drugs came from, I think you're mistaken. I don't think they have to do that. You also heard that drugs today are already being manufactured someplace else. That's absolutely true. But this bill doesn't just talk about manufacturing. Colleagues, I'd have you look at page 3, line 13, page 3, line 21, page 3, line 25, 26. Are we talking about manufacturers in this bill? Yes. Who else are we talking about? Wholesale distributors. So, the drugs that we get into the US today are being manufactured overseas. Okay, where are they being distributed from? Right here. What else does this address? Pharmacies. This bill allows foreign pharmacies. Guess what doesn't happen today? Foreign pharmacies. So when you hear that drugs are being manufactured overseas, colleagues, you're only getting part of the story. This bill isn't only talking about manufacturing. It's talking about a lot of other entities that we are now ceding to a foreign government. I'm not even sure I trust our own government. Now you're telling me I'm going to trust the government of overseas somewhere? And my last point that I'd have you consider is, why are we expanding into countries outside of Canada? First of all, to my knowledge, in 6 years of talking about this, we have not got one pill legally into this country under this program. Not one. And that was under the Canadian program, our neighbors. Not a single pill has come in yet. And before we even get our very first pill from Canada, now we're opening up to all these other countries. Why are we doing that? I have a belief that the reason why we're doing that is Canada has already told us, no thanks, US. Not interested in playing along. You have 50 million people in your country. We've got less than 50 million in Canada. Canada doesn't even have enough drugs for Canadians. And they already passed, whether it was a law, a referendum, something that said, we're not going to ship the drugs that we feel we need in Canada to the US. And now we think that other countries are? What do we think, Canadians are stupid? Every country, colleagues, once they learn that we're going to try to take their drug supply, in my opinion, is going to follow Canada. They're going to say, no thanks. 350 million pharmaceutical consuming Americans will overwhelm any of these other countries. You're going to have to expand to countries that say yes. And this bill doesn't prohibit that. This bill says the bureaucrats in Washington, D.C. get to decide this. That's what this bill says. Show me any page, any line in this bill that says you have a choice as a patient, that you get to decide what country these drugs come from, and that you're going to experience savings. And I am all ears, colleagues.
Senator Quorum.
Thank you, Madam Chair. The good senator from Douglas County, finally we have something that we can agree on. He said he doesn't trust insurance companies. I don't either. You know, I had a friend that had life insurance and he died anyway. I talked about my blood pressure that some of you may have caused. At the suggestion of the good senator from Weld County, she asked me where it come from. My comment's Walgreens. No, where's it manufactured? I'm kind of slow, okay. Where's it manufactured? Oh, India. India's not on this list. Mexico's not on this list. Many of the drugs that come through Canada are manufactured elsewhere in the EU. And we're not getting rid of the FDA. We're actually giving oversight. And yes, we have not imported any drugs from Canada because we have a little organization back in Washington, D.C. that has to approve everything. And have good friends that have been back there serving in Congress and the Senate. And there's a thing back there that I don't think there's a cure for. It's called gridlock. But the application went in November, and we had a change of administrations, and we were on the road to getting prescription drugs from Canada in Colorado, and we had a change of administrations. We're told that the FDA directors have not approved this. They haven't been approved themselves. So no, they have not. But this is an opportunity to save money. The good senator from Larimer County talked about Department of Corrections. And I ran this a few years ago because the cost of prescription drugs in corrections is extremely high. And I started checking around. I told you my blood pressure comes from India. Hepatitis C is rampant in the correctional facility. There's a product called Harvoni, made in the U.S. A 12-week regimen of Harvoni in the U.S. costs us $94,500. my good friends in India, and this was a couple of years ago at that time, I could get the drug in India for $1,200. That's major savings. Unfortunately, Harvoni is not on the list yet, but I would hope that it is, because we are talking major savings. Major savings. Safety. Somehow, people think that there's a third world country that's out there selling everything to King Soopers and Walmart and all the chains. No, I don't think so. I don't think so. The liability of them doing that is not worth the risk. So I'm going to say that yes, we can provide safe, dependable, inspected prescriptions and save the citizens of Colorado a lot of money in the meantime. Ask for an aye vote.
Senator Janelle.
Thank you, Madam Chair. And I just wanted to say thank you to the good senator from Montrose for his comments about different types of drugs and the costs and how we really can save money by importation from other higher income countries, not India, not ones that we may question. The good senator from Douglas County said, well, Canada's doesn't want to do business with us. They do. Canada had some concerns because they are a tenth of the size of the United States. And they were concerned with the fact that generic drugs, we were going to drain them dry of their generic drugs, because that is what the majority of their prescription drugs that they utilize in Canada are. Well, we're not looking at generics as much as we are brand name drugs, because that's what costs us a lot of money. And they don't pay as much. Probably, a third as much or a quarter of what we pay for those brand name drugs. So if we can import the brand name drugs, which is the bulk of the expense, as well as some specialty drugs, we're going to help patients be able to afford medications. And the thought that, the Canadian drug manufacturers are not legitimate. They're registered with the U.S., the FDA, the United States FDA, and they produce drugs for the United States. There's more than 30 Canadian drug manufacturers, and they have to abide by all the safety standards that's comparable to what we have in the United States. And again, just to say this, they are basically tested twice. They are tested for their purity and for all of the, track and trace and all of the things that we have to test them for by the exporting nation, and then they come over to the United States and they go through the same process. And not only is it within the FDA, but it's also with the middlemen too, the vendors and the pharmacies, the carriers of the drugs. Everybody is inspected. That safety is there, folks. And for the sake of the people of this state who can't afford to take their medication, I urge for your support on expanding the importation of drugs, not just from Canada, but from other countries. Thank you.
Senator Coram.
Thank you, Madam Chair. Just a quick reminder of where the savings would come from and how negotiations may help. I don't know if any of you can watch television, But the pharmaceuticals spend $200 million a month on 10 prescription drugs, promoting them. $200 million a month. And advertising prescription drugs is only legal in 3 countries. $200 million a month.
Seeing no further discussion, the motion for the body is the adoption of Senate Bill 123. All those in favor say aye. Those opposed, no. The ayes have it, and the bill is adopted. Majority Leader Fenberg.
Thank you, Madam Chair. I move the committee rise and report.
The motion before the body is to rise and report. All those in favor say aye. Fantastic. All of those opposed, no. The ayes have it, and we will rise and report.
The Senate will come to order. Please add Senator Sonnenberg to the roll. All those in favor? No. Senator Zenzinger.
Thank you, Madam President. The committee has met and had one bill under consideration. Will the clerk please read the report?
Madam President, the Committee in the Whole begs leave to report has had under consideration the following attached bills being the second reading thereof and makes the following recommendations thereon. Senate Bill 123 passed on second reading in order and engrossed and placed on the calendar for third reading and final passage.
Senator Zenzinger.
Thank you, Madam President. I move for the adoption of the report.
The motion is the adoption of the Committee of the Whole report. Are there any no votes? With a vote of 35 ayes, 0 noes, and 0 excused, the Committee of the Whole report is adopted. Senate Bill 123 is passed on second reading in order engrossed and placed on the calendar for third reading and final passage. Consideration of House amendments. Will the clerk please read the title to Senate Bill 65?
Senate Bill 65 by Senators Liston and Representative Mullica concerning the disclosure of information related to the gasoline and special fuels tax.
Senator Liston.
Thank you, Madam President. I move that the Senate concur with... I know members, that the House tried to improve this landmark legislation, and they modestly did. So I do move that the Senate concur with the Senate amendments to Senate Bill 65.
Senator Liston, thank you for that motion. Could you explain what the House did to the bill?
Yes, thank you, Madam President. Well, members, if you recall, a few weeks ago that when I introduced this legislation, it was landmark legislation, and it still is today, even despite the amendment that the House tried to put on. The bill in Section 1 generally referred to the fuel tax auditing statutes, as well as the requirement that the distributors file the fuel tax reports. There's been some questions, though, about the scope and the amended language more specifically drilled down to the state to state the specific information that would be shared instead of referencing the sections generally. And that's what the amendment does.
Is there any discussion? The motion is that the Senate concur with House amendments to Senate Bill 65. Are there any no votes on concurrence? With a vote of 35 ayes, 0 noes, 0 excused, that motion is adopted. Senator Liston.
Yes, thank you, Madam President. I move for the repassage of Senate Bill 65 and that this will enshrine this bill into the Legislative Hall of Fame. Thank you, Madam.
The motion is the repassage of Senate Bill 65. Are there any no votes? With a vote of 35 ayes, 0 noes, 0 absent, and 0 excused, Senate Bill 65 is repassed. Co-sponsors. If you already are on it, you are still on it. Minority Leader Holbert. Consideration of governor's appointments, consent calendar. Will the clerk please read all the appointments listed on the consent calendar?
Members of the Colorado Racing Commission for terms expiring July 1st, 2024, Justine Scott Estes of Gibson, Colorado, Republican from the 3rd Congressional District to serve as representative of the racing industry, reappointed. David N. Hoffman of Westminster, Colorado, Democrat from the 7th Congressional District, who was previously engaged in the racing industry for at least 5 years, reappointed.
Majority Leader Finberg.
Thank you, Madam President. I move for the confirmation of all the appointments listed on the consent calendar, which includes members of the Colorado Racing Commission.
Is there any discussion? The motion is the confirmation of all the appointments on the consent calendar. Are there any no votes? With a vote of 35 ayes, 0 noes, 0 absent, and 0 excused, the appointments are confirmed. Message from the governor.
January 8th, to the Honorable Colorado Senate. Ladies and gentlemen, pursuant to the powers conferred upon me by the Constitution and laws of the state of Colorado, I have the honor to designate, appoint, reappoint, and submit to your consideration the following members of the State Housing Board effective January 31st, 2021, for terms expiring January 31st, 2025. Samuel Gerard Betters of Loveland, Colorado, serve as a Democrat and resident of the 2nd Congressional District, reappointed. Candace Marie Payne of Stratton, Colorado, Republican and resident of the 4th Congressional District, reappointed. Jared Ryan Moses of Colorado Springs, Colorado, Democrat and resident of the 5th Congressional District, appointed. Sincerely, Jared Polis, Governor.
Local government. Signing of bills.
The President has signed Senate Bill 42, 111, 112, and 113. The President has signed Senate Bills 19, 41, 43, 44, 45, 46, 47, 48, 49, 50, 51, 52, 54, 109, and 110. The President has signed HJR 1002.
Announcements. Senator Zenzinger.
Thank you, Madam President. The Senate Education Committee will meet today at 1:30. We will be hearing House Bill 1161 as well as Senate Bill 106.
Senator Lee.
Thank you, Madam President. Judiciary Committee will be meeting in the old Supreme Court to hear 2 bills, Senate Bill 88, Child Sex Abuse Accountability Act, and limit the detention of juveniles at 1:30 this afternoon. Thank you.
Senator Hansen.
Thank you so much, Madam President. Members of Senate Appropriations, we will meet tomorrow morning at 8:30. We will have 9 bills. You'll find them listed in your calendar. See you 8:30 sharp for Senate Appropriations.
Senator Hansen, would you also announce today's committee? It's on the calendar.
Oh, thank you, Madam President. There will not be a meeting of Senate Appropriations today. We were considering doing 1 bill, but we're going to save that and do that tomorrow morning at 8:30.
Thank you, Senator. Further announcements. Majority Leader Finberg.
Thank you, Madam President. We will be recessing. You don't need to be here. We will not be reading bills across. But we are going to keep the desk open so that we can get the Education Committee report, read that report across so that then that bill that was just referenced, if it gets out of committee, who knows, but if it does get out of committee, we will try to make sure it's heard in Appropriations Committee tomorrow morning. So we're going to keep the desk open so we can get that report read across this afternoon. Madam President, I move that the Senate recess until 12 noon today.
You have Senator Smallwood.
Thank you, Madam President. I just want to let the body know that I will not be in town tomorrow and ask to be excused.
Senator Smallwood will be excused with questioning tone. Majority Leader Finberg.
Thank you, Madam President. I was just conferring with the minority leader and forgot to give an update on the weather. As you'll see behind me, there is a storm moving in. No, I was being your meteorologist for a moment. My sense is that the storm is really going to be hitting Friday afternoon. So we will try to keep Friday morning's floor work quick so everybody can get out of here and get home safe. I think there's still an open question on what the storm is going to do for the Monday commute. So that is where we are right now. We plan to come in tomorrow, hopefully get out of here pretty quick so people can get home, and we'll be in touch over the weekend if it looks like Monday is going to be delayed or anything like that because of the snow. So we'll see. But plan on being here tomorrow, and we'll try to keep it short on the floor.
A little while ago, you had heard the motion that we stand in recess until 1200. Seeing no objection, the Senate will stand in recess.